My name is Tarnisa Martin, passionately known in the community as Nurse T. I am the patient resource and community advocate for Hurley Medical Center, as well program director for Michigan United. I was born and raised in Flint, Michigan. I am a proud Wildcat. I graduated from Northwestern High School. Ooh, you should have been a Wildcat. I also lived most of my youth years on the north side.
Mm-hmm. Where do you work at currently?
Currently, I work at Hurley Medical Center.
Okay. How long have you been working?
I have been at Hurley Medical Center probably about 24 years. I started out as a nurse extern, and then once I graduated U of M Flint from nursing school, most of the time served there have been being a nurse.
Can you tell us about some of your experiences dealing with cancer, personal experiences?
Yes. So I got a call from one of the physicians saying that my grandmother's cancer markers were up. Being a nurse, I immediately knew what that meant. And she was diagnosed with pancreatic cancer. So she died probably within 3 months of us finding out. So that was a rough time because my grandmother was like my hero. By the time they found it, it was too late for treatment. Pancreatic cancer is one of those cancers that spread rapidly.
What type of practices do you practice when dealing with cancer patients?
So basically, just being a nurse in general. Being a nurse, we care for all types of patients. So all of our patients have all types of medical conditions. I've been a nurse for 24 years. I started out in med-surg. I've worked med-surg, cardiac, which is the heart. I've worked renal, which is your kidneys. I've worked critical care. I've worked rapid response. I've worked case management, and I've also been a supervisor over a busy med-surg unit. So patients coming in, nausea and vomiting, not feeling well, then later finding out they have a diagnosis of cancer. So just being at the bedside, caring for patients, following physician's orders. I have seen a lot of patients transition and being discharged because they found out about cancer early and they got treated and they had chemo, and one of the devastating things is losing their hair, but they were able to go home. And then on the other side, I have cared for patients that came in. Unfortunately, it was at the late stages and they were transitioned to hospice with their family.
What do you think people should know more about cancer?
I think they should know, like, as far as lifestyles, as far as how we eat, what we eat. I'm praying that as days progress, that we'll have access to more healthier foods. And then exercise, sleep. It's a lot of things that we can do. But the one thing about cancer is prevention, is making sure you're getting your screenings, making sure you're going to the physician, and making sure if you're noticing anything that's abnormal, you're reporting it. Like far as women doing their self-breast exams, men doing their testicular exams, the colonoscopies, having those screenings for prostate, just whatever screenings that we can do in advance, making sure we know that, and as well, knowing signs and symptoms, and knowing if signs of things that are abnormal, and knowing to report that to your physician early.
Do you think doctors or anything in general doing the medical field could do better caring towards patients that have cancer?
I think maybe some of the tests and that partnership and that relationship that physicians and patients have. One thing that I have noticed within the Black community is a lot of times we don't share our family history with our family, and so we don't know to go into the physician and discuss those things. So like, say for instance, having that relationship and that open dialogue to where we could share with our primary care providers our histories and our family histories, so then they would know to start those screenings early. So, like if your mom or your grandma had breast cancer, so instead of waiting to around 40 to start the screenings, maybe they'll start them early. So, yeah.
What has kept you motivated to be a nurse in this field?
Being able to care for patients, being able to educate patients, provide the services with a smile. I always say patients never remember what you done for them. They always remember how you treated them.
Do you think some people were affected through the Flint water crisis to contract cancer?
Yeah, I think the water crisis, the lead, a lot of the environment, a lot of things that was in Flint may have impacted our community's health.
What do you think kids like my age and below can do to kind of help bring awareness and stop cancer?
Just, I think, to me personally, health literacy. That's what I would like to see. Statistics were saying a couple years ago that about 22% of Americans are health literate. So that means that about 80% of the communities or Americans don't know what's going on. So, but when young people know signs and symptoms and know what to look out for, and then they know what to prevent and they know what to do better.
Going forward with that, like companies that like produce Takis or anything like that, do you think they should do a better job at like not selling products that could be harmful to youth, especially addictive?
Yeah, I think they can do, because a lot of times they know, the side effects of it, and then people just do it anyway. Just like even a lot of the nicotine and the vaping and all of that. Yeah, but it's just having that strong will and that strong mindset to make a decision to not partake in those things.
Gotta run with the great crowds.
Gotta run with the great crowd. The crowd that's healthy, the crowd that's productive, that crowd that's wanting to make a decision for their lives. I always say your life and your decisions start with you doing the right thing so that you can have a healthy life. Activate your healthcare power.
Is there anything else you'd like to share about your journey or any advice you have?
I can say that from being at the bedside to supervision to being out in the community, caring for patients in the community and being able to provide resources and information so that they can have better healthcare outcomes have been so rewarding. And I'm glad that we're doing the studies, we're doing the work so that our community can be healthier.
Do you think that teachers and administrators should do a better job at teaching kids about important things like cancer?
Yes. I think health awareness is important. But it's also how we teach it. Sometimes we be like, don't do this, don't do that. We need to tell you guys why. And then also reach out to you to see how you guys better understand it so that it's more relatable to you versus just telling you not to do it, because the curiosity is there. Like when you think about a lot of people vaping and they have a lot of conversations, but it's easy access to get it. But then knowing that we know that a young guy had to have a double lung transplant because he was vaping. Just knowing the harm and the consequences of the choices, but just putting it in a way to young people to where they can receive it and not feeling like we're talking down at them, but we're talking to them so that they can make a wise decision. Because you are the holder of your future.